Hi, I'm your Senator Chuck Grassley once again with my weekly webcast. Today we have an opportunity to ask Chuck your questions that have been emailed in, and remember, in future webcasts we welcome your email questions, your questions on Twitter, your questions on Facebook to me, so that they can be answered at this particular time. So I picked two questions this week to answer. The first one is from Pam in Davenport. Can you explain what the public option will do? Are you for or against including in this health care reform bill? A public option would be a brand new government-run health insurance plan that's supposed to compete with private insurance plans and give more competition. I oppose it because I believe another government-run plan would be the sort of a thing that would not be competitive with private plans, but would undercut private plans and drive private plans out of business, because government is not a competitor, government is a predator. And consequently, with that being the case, a lot of healthcare economists have studied the impact of a government-run plan, and they say that small business would push a lot of their people out of their own plans into a government-run plan, and consequently you could get Heritage Foundation says 83 million, Lewin Group says 120 million people would be out into the private plan, into the public plan. And then if that happened, rates for everybody else would go up, and then pretty soon everybody would go to the public plan, and then pretty soon you would have a 100% government-run health care plan like they have in Canada. It's called a single payer. And I think that with that you get a lot of rationing of care, you get denial and delay of health care delivery. Like, for instance, in Canada you got to wait 3 months for an MRI. In America you don't have to do that. I don't think we want our health care system to deteriorate to that effect. So consequently, I think a public option is a step towards a 100% government-run plan where people don't have choice. We want to expand choice, not limit choice. Consequently, I think it would be bad for a healthcare system, and that's why I oppose it. I think it has a very good chance, though, of eventually coming out. So if you've got opinions on this, you need to write to your congressman and senator and tell him what you think of the public option. The second question comes from Facebook, Leanne from Des Moines. What is Congress doing to address the ACORN documented fraud and tax evasion? Well, by overwhelming votes in both the House of Representatives and the Senate very recently, both bodies have decided that no more public dollars could go to ACORN. Also, the Census Bureau has decided not to use ACORN, and ACORN itself has fired people and done its own investigation. But I hope that we are done with ACORN getting any public dollars. Also, 3 years ago, but you wouldn't know it because at that time I couldn't get any interest in anybody in the press or media talking about what might be wrong with ACORN, but I instituted, as part of my private nonprofit foundation investigations and nonprofit organization investigations, looking into ACORN. And I have since then written several letters to the Internal Revenue Service looking into their nonprofit status, because it looks to us like ACORN is not just one organization, but it's a conglomerate of 42 nonprofit organizations that tended to funnel tax-exempt money up to the parent organization ACORN that could have been used for purposes like political activity that was not legal under nonprofit status. So I thank you, Amanda and Leanne, for your questions, and hope other people will continue to ask questions via my Ask Chuck webcast. Also, at the end of a program, I always tell you what the Senate's doing this week. Two things I want to mention. On the Senate floor, I think the entire Senate debate's going to be focused around the Defense Department appropriation bill. An annual appropriation bill generally takes at least one full week to get through all the issues connected with our national security appropriations. And then secondly, I think most of this week, most of my time will be taken up with continuing the amending process on health care reform, which now is more of a partisan bill, even though for 3 months I was working to make it bipartisan. But there were so many differences between us Republicans and the Democrats that we couldn't reach an agreement. So pressure from the White House and from Senator Reid caused Senator Baucus to move ahead in a partisan way. I think he did not want to do that, but he had to do it. I'm sorry it turned out to be that. But maybe in the end we wouldn't have been able to reach a bipartisan agreement anyway. But I still thought that maybe another couple weeks would have given us time to do that. Thank you very much for listening to this webcast, and make sure you tune in next week, please, and email your questions to Ask Chuck.